Hello, my name is Ward Blanchard. I'm CEO and founder of the Blanchard Institute and human service professional for nearly 20 years, working with individuals and families across the nation struggling with mental health and substance use disorders. And one of the main barriers and biggest problems and misunderstandings that we have when treating this disease is centered around the idea that the identified patient, the person of concern, the one that's struggling with mental health issues, the one that's struggling with substance use disorders, has to be motivated or has to understand that they want help and need help and has to be motivated consistently to get treatment. That is categorically false, and there is a misconception around that idea. And I clarify this for families and professionals. If somebody's going to live a lifetime of recovery, yes, they're going to eventually have to want it. They're eventually going to have this internal mode of change, but not in the beginning. What we know is most mental health issues are a dysregulation in the frontal cortex. Substances of abuse affect the body differently initially. We've all heard of uppers and downers. Those of us that like to go fast with cocaine, speed, meth, Ritalin. Those of us that like to go slow with marijuana, opiates, alcohol. Uppers and downers affect the body differently initially. But in the end and in the long run, all of those chemicals affect the body and the brain the same way, and they shut off or severely diminish the activity in the frontal cortex. And why is that so important to the professional community, and why is that so important to empowering families? Is because that's the part of the brain that controls executive functioning, common sense, emotional regulation, judgment, reason, problem solving. Everything that makes us individual, everything that makes us human is not working properly. That's why the most common statement I hear from families and loved ones is, I just want my son back. I just want my daughter back. I just want my spouse back. It's like Invasion of the Body Snatchers, Dr. Jekyll and Mr. Hyde. It's because the part of the brain that makes them unique in who they are, the common sense, the rational executive functioning of their brain is not working properly. So why would I ever expect somebody without a properly working brain to ever realize they want it and need to get better? And secondly, we know that these chemicals affect the dopamine part of the brain, the motivation center of the brain. So why would I ever expect somebody to be motivated consistently when the very disease dysregulates their motivation? And so what this says is there is a tremendous amount of steps and actions that a family and surrounding loved ones can do, should do. There's a tremendous amount of hope and steps that they can take. You do not have to wait until your loved one wants it or recognizes they need help. There's a tremendous amount of steps and actions you can take, and this is just like any other disease. The earlier the professional intervention, the earlier the treatment, the higher the prognosis.